Okay, so why don't we go ahead and get started? It is my pleasure to introduce Dr. Ryan Sullivan and David Henderson. Dr. Sullivan received his PhD from Syracuse University in 2010 and currently holds a position as an associate professor of economics at the Naval Postgraduate School. His research specialties include program cost-benefit analysis and value of statistical life analysis of value of statistical life evaluations. His work has been discussed in such prominent outlets as Time Magazine, Forbes, Wall Street Journal, USA Today, US News and World Report. And Dave Henderson is an emeritus professor of economics at the Navy Postgraduate School and a research fellow with the Hoover Institute at Stanford University and a senior fellow with Canada's Fraser Institute. He was previously a senior economist for health policy and energy policy with President Reagan's Council of Economic Advisors. And I can go on, but I'll just go ahead and turn it over to Ryan Sullivan and Dave Henderson. So, gentlemen, welcome.
Thank you. Thank you, Hanson. I'd also like to give a quick shout out to the Naval Postgraduate School Foundation for help facilitating this with Hanson.
Yeah, and I forgot to say that. Thank you, Ryan. So Rich Patterson at the Navy School Foundation is a guy who really coordinates a lot of this for us. And so the Navy School Foundation is phenomenal. They're providing us with all these great speakers and very interesting topics. So thank you, Ryan, for taking it.
Hey, Ryan, before you start, could I just kind of tell? So yeah. Ryan looked at a lot of the studies behind our article in the Wall Street Journal. I did a rewrite of his thing, so I'm more the writer. So Ryan is going to take the lead, and I'm going to kibitz once in a while, just put in my input, but Ryan is the lead speaker.
Yeah, and we'll obviously after the short kind of slide presentation, we'll have a big open discussion for everybody. So okay, I'm gonna just go through the slides. It's mainly to just get everybody on board for where we are in the literature, and then that way we can kind of open up the discussion. So let me pull this up quick. All right, can everybody see that?
Yep.
We good? Okay, so David and I, we're going to be talking about the school shutdowns, and basically this is kind of the outline. We wrote this op-ed together last month for the Wall Street Journal, and in that op-ed we were arguing that basically opening the schools would pass a cost-benefit analysis. You're going to see, we're going to talk about a lot of the costs for opening schools. We'll run through all the numbers. We're going to talk about the benefits of opening the schools. And then we're going to kind of get into the details about how economists view these kinds of topics, okay, and how to flush out some of the numbers to see if this makes sense or not. So just to get up to where we're at really today, the previous research on this, a lot of it was coming from foreign countries. So, the US shut down, and, we didn't have a lot of data really on the US side. Okay, that's changing now, which I'll get to in just a sec. But so a lot of the early research was coming from other countries because there were a bunch of countries that never shut down their schools. Okay, and so the research from those countries was very positive. So it was, they weren't showing a lot of transmissions within the schools, and there wasn't a lot of community spread from them. Okay. Now in the US, like I said, early on, we didn't really have much, but over the course of the summer, we started gathering some data, not David and I, but researchers had started gathering data about very specific cases in the US that were similar to schools. So if you look at the YMCA camps, there's a whole bunch of data that was coming out from the YMCA camps, and they just weren't seeing the outbreaks there. Okay, now fast forward to today, it was a little unclear about, okay, we had these previous studies, they were showing low infection rates, but maybe there's something about the US system that would show something different, okay? And come to find out, once the data started being released, it was really the same. we still just aren't seeing a lot of transmissions within the schools. Okay, so the new data that has been released, Emily Oster has been spearheading the gathering of this with a group of researchers. She's out of Brown University, and the new data since the schools have opened up, not in Monterey County here, but across many parts of the country, the data show that the rates, the COVID-19 case rates in these schools, they're just really low. So her data cover about 200,000 kids. You're looking across 47 states, and you can see the rates there. So at the time of the writing that David and I did the Wall Street Journal article, the case rates for those schools that they had data on, they're looking at a 0.13% among the students and 0.24% among the staff. Now it's interesting, there's even more data that has come out since our article. If anybody has been reading the newspapers, the New York City school data is showing something very similar, okay? So it isn't just this data, it's more and more is coming out at this point, and we're seeing very low infection rates being transmitted.
Ryan?
Yes.
This is Giff Lehman. I've heard in the past that there's a difference of infection rate depending upon the age of the students. Are you seeing that or not seeing that? Could you talk to that at all? And the data you're looking at, is it all ages or are there specific ages?
Yeah, so I think that's a really important point, Giff. So there are differences in the transmission rates by ages. So we didn't talk about this study, but there was a study out of South Korea where they did contact tracing for many of the different people. There's been a bunch of studies like this. Basically what they found is that for say elementary kids, the transmission rates are extremely low. Like they're not seeing the numbers come on the elementary kid side. Where we have seen outbreaks, there's been isolated outbreaks. So Israel had an outbreak, for example. There was also an outbreak in Georgia. I don't know if you remember early on when the schools were opening up, there was social media, some of the newspapers, they had this photo of this high school in Georgia where everybody was packed together in the hallway and they didn't have masks, and they ended up having an outbreak there, okay? Where they have had the outbreaks, that has mainly been in the high schools. And so what the literature has found, for whatever reason, it looks like teens it's more likely that they would have higher transmission of COVID in comparison to the elementary kids. I don't know why that exactly is. David, I don't know if you've seen anything, but I think it's kind of unclear in the literature for why, but you do see lower transmission rates with the younger children. I would argue that the outbreaks that we have, though, are isolated incidences. And when you track across many different school districts, like with Oster's data, we just see really low rates across the board. There are small risks for opening, but in general, when you look across many school districts, they're just really low. And usually they come from the high schools, is what we've seen.
But I do want to point one other thing, the difference between the case rate and the infection rate. Seroprevalence studies now, there was one, the first one was done by Jay Bhattacharya up at Stanford, and he got hammered for this. I met with him on Tuesday, had lunch with him. And, he did make one statistical mistake. He corrected it. The results were pretty similar. But since then, there are about 20 studies from around the world. And the seroprevalence study, that's to take random people and say, do you have evidence that you've had it? Do you have antibodies and so on? And those studies showed a few months ago that the infection rate was roughly 10 times the case rate. So what that would say with our data today in the United States, with 11 million people having had cases, that would say that really there are 110 million who've had it. So just that's another reason to say that even for people in their mid ages, 40, 50, and 60, and so on, the fatality rate is extremely low.
David, I don't think I know the difference between infection rate and case rate. Could you just define that for us?
Yeah, so typically when people get tested, they come forward because they think they have some symptoms. And that's called a case. But But if you go out and just randomly take people who haven't come forward, so it includes people who have come forward and people who haven't, you're getting a broader sample of the population. You're getting people who had symptoms that were so mild that they didn't even know they had it, or maybe didn't have symptoms at all. They were asymptomatic, and yet they have evidence that they had it.
Yeah, I mean, for example, I had a risk analysis piece published this summer, and the data we're saying it was something like 40% of the cases are basically asymptomatic. Of the infections are asymptomatic, and so many of those people they just don't get tested. So, what David's talking about, that's spot on. Like the actual number of infections are a lot higher than what is the confirmed case totals that you see from the CDC.
Right. Also, people might have symptoms, but they're relatively mild. So, for example, we were down in Southern California in January. I got very sick, and I was sick, came back here. I was sick for about 2 weeks. I got an antibody test 4 months later, and it said I hadn't had it. But it turns out the antibodies can disappear after about 2 months, which doesn't mean you're going to get it again, because there are these T cells, all these other things that get ramped up. And so I might have had it, but the antibodies disappeared.
Any other questions? Okay. Okay, getting at the negative consequences of possibly opening up the schools. So we're going to first focus on the actual people in the schools, and then we'll get into more of the community spread issue in just a second when we run through the cost benefit numbers. So I think most people are aware of this. COVID doesn't have as big of a negative consequence or outcome with children in comparison to the elderly. So if you look at the numbers, I had a piece that I wrote with Tom Kniesner that's forthcoming in the Journal of Risk and Uncertainty. The numbers that we were finding with the data, 1.2% of the COVID hospitalizations are with people aged 19 and under. It's pretty low. And then, if you look at the fatalities for children are just extremely low. So David just checked these numbers out. As of November 12th, you pulled up the numbers, David. Right. We were at 81 deaths for children under the age of 15. Now, if you compare that with say, something like the flu, the 2019-2020 flu season, we're looking at 434 children under age 18 died of the flu. So it's always weird kind of comparing against the flu, because for children, it's showing that this is a very low risk for children when compared to the flu. Now, just be aware, like for the elderly, it's a much different story. This is a very deadly disease for the elderly. So if we were comparing the elderly deaths to the flu, it would show a much different story. But for children, it just doesn't appear that this is that deadly for them. Okay. Now with teachers, that's the other group of people that are going to be on, right in the middle of this. We see that from Oster's data that the infection rates are quite low. The case rates are quite low in the schools. Unfortunately, we don't have data, at least to my knowledge, on the fatality rates of teachers in the United States. Now, we do have data from other countries. Okay, so Sweden is a good example. They track all this stuff. So there was a recent study that looked at the fatality rates of teachers during COVID versus other professions. And they were finding that, if you compare against something like IT technicians, teachers have the same fatality rate. And they never shut down schools in that country. So it's just the negative outcomes for the people that are actually in the schools look to be very low. The only real argument that you could have, I would say, is if this got out into the general public and it starts killing off, the elderly population, which that is a concern. But we're going to run through some of those numbers, what they would have to be for that to make sense. The impact on the people in the schools, the negative outcomes are quite low from what I can tell in the data. And I think these numbers show that.
And I just want to point out one other thing. So when Ryan and I submitted it to the Wall Street Journal, the editor was a very sharp editor. And so she caught our statement, that last bullet point there, and said, well, were the IT technicians inside the schools or were they kind of on their own? And we said, we have to admit we don't know. But if you think of the stereotype of the IT technician, that person was probably sitting somewhere on his own. So I think that would be true of a large percent of them.
One of the questions I have, I was interested in your presentation because I have an affiliation for a high school in the community here. And obviously the schools are as anxious as anybody to get back to business. And one of the real issues that they deal with is teachers saying, well, you can open the school, but I'm not going to be there. And so, how do you, certainly with evidence can help persuade people, but, and maybe this is beyond the scope of what you're going to talk today, but to the extent you have any insights, that would be interesting.
Well, actually we do. This was one of the points I said I would handle. I guess I can handle it now. My view is that if they don't want to be there, they shouldn't be there. But I think there'd be a lot of teachers, especially young ones, who would want to be there. So it's like any other job. This is not special in that sense. If you don't want to have that job, you shouldn't have that job. And it shouldn't be the case that we're paying them not to be there. And
well, I have a daughter-in-law.
Areas where the teachers are where they're going to lose their pay for not being there, they suddenly change their attitude about this.
I have a daughter-in-law who teaches at RLS in the lower grades, and she's anxious to get back into the school.
Yeah.
And her compatriots pretty much feel the same way. They want to be there.
Yeah. And I got a really nice letter. People said, did you get hate mail after that article? I got this letter from this third grade teacher in a charter school saying, I'm dying to get back there. I can see which kids are getting it and which aren't, and I can get to them all. I can get, and maybe she means 90%, but she can really teach more effectively if they're there. So it's not the case that there's this uniformity. Not Gil, that you were saying there's this uniformity, but I think that's also something to keep in mind.
So these are basically the negative outcomes that you could have with opening the schools. Okay. Now, David and I both think the negative outcomes are pretty low in terms of the cost. So the question is, what are we missing out on? We got all these schools shut down. What are we missing out on? And the first thing that immediately comes to mind, I think, to most people is the human capital development. Okay. Now, there are all kinds of studies out there that show this. David and I picked a couple of them to throw in the article. All of the numbers that I have seen are very large. Okay. I would, there are numbers out there that would make your eyes kind of swell up. But these were actually some of the lower figures. There are issues with some of these studies, which David will talk about in just a sec, but some of the numbers that we've been seeing in the literature, this early report that came out from McKinsey and Company, they're looking at between 61,000 and 82,000 in terms of lost lifetime earnings. And that's just for a shutdown up through January. If you look at this Georgetown University study, they were looking at more of the aggregate numbers. They're looking at $2.5 trillion in terms of lost future wages. Once again, that's a 4-month shutdown. Okay, the numbers are large. Okay, and one of the reasons why economists really care about this kind of stuff is that it's not just you're losing earnings. What economists have found through many studies over the years is that if you have lower earnings, lower income over time, that has an immediate impact on your health. You're not going to be out there buying healthy food, buying safer cars, that kind of thing. And what we see happen is that it plays out is that your life expectancy rates go down. If you have lower income level, you're not a lot. Your life expectancy numbers come down, and so this is a big problem. Okay, because of what's going on here.
Is this now time for me to add my point, Ryan, or should we wait?
Why don't we wait until it's coming right up here with the CBA. So I'll hand it off to you just right after I just show this equation here. So the question is how do economists weigh these trade-offs? We view things, David and I probably view things much differently than a lot of ordinary people in the public. But we've been doing this for many years. The standard methodology, basically what you would do is you try to place a value on the lives lost, or in this case, the lives saved. And you compare that with lost GDP levels. And so we know with lost GDP that actually impacts life expectancies as well, right? So the idea is you look at the net benefits. So you take the value per statistical life. Now, I did a calculation with a couple co-authors over the summer on this, and we were finding that the value per statistical life for this particular pandemic should be estimated at 4.5 million. Okay. What we do is you would take that 4.5 million, you would multiply it by the number of lives saved. Now, you could use this for the general economic shutdowns as well, but we're doing a specific case on the school shutdowns. You take the value of the lives saved from the school shutdown and you compare that with lost GDP. If the value of lives saved by shutting down the schools is more than the GDP loss, we would say, if the value of the lives saved is more than the GDP loss, we would say we should shut down the schools. Okay. Now, if the GDP loss is greater than the value of the lives saved, then we would say the opposite. Okay, now, David, why don't I hand this off to you right here? Because this is right up your alley.
Yeah, so Ryan is the expert on estimating these, but I'm older than him. So I've been using these kinds of numbers for 30 years now in my cost benefit analysis course when I taught at the Navy School. So I want to tell you, people might think, well, what do you mean 4.5 million? The value of life is infinite. Okay, here's why it's not infinite. This number, these kinds of estimates come from the following kind of data. How much do people, holding all else constant, need to be paid to take on a slight added risk of death? And it's always a finite number, because after all, you do have coal miners, you do have firemen, you do have farmers, by the way, their job is riskier than that of policemen. So you have all those things. And then they say something like, what's the extra pay to take on a 1 in 10,000 additional probability of death in a year? And you get a number like $500. So then if you have 10,000 people, the expected number of deaths of those 10,000 with 1 in 10,000 probability is 1. So you have to pay 10,000 people $500 each, which is $5 million in total for one of them to lose his or her life. So that's kind of there are little wrinkles, and Ryan knows those wrinkles, but that's the basic big picture story.
David, why don't you keep going with
yeah. So here's what we did. You remember that 2.5 trillion Ryan showed you? And that was that one study based on closing the schools for 4 months. It looks like in many cases, they'll be closed for 8 months. And so we could have taken 2.5 trillion and even argued that it was minimal because it's for 4 months. We went even more conservative and took $1 trillion. And here's my reasoning, and we're going to get to how it can be higher than $1 trillion in a slide or two, but here's my reasoning for that. The standard view economists have had of education, and Ryan laid it out, is it builds human capital, what's in here. But there's another view of education that has more and more evidence behind it. And that is that it's mainly about signaling. It's signaling to a potential employer, I can hang in there, I can comply, I can complete a task, namely the task of finishing first high school and then college. And to that extent, if that's true, and if that's a major factor, it's more like we're all on this rat wheel. And so everyone's off the rat wheel for 4 months or 8 months. And so, yes, you're not getting that component of human capital, which even the signalers admit is there, but you don't lose as much human capital as you might have expected, because what people were in coming up with these estimates, they're figuring you're getting this higher pay because of all these skills rather than you're getting higher pay because of the signaling. So a friend and colleague of mine, I blog on something called Econ Log, and so does he, is Brian Kaplan, who wrote this book titled very provocatively, The Case Against Education. I told him, really, it should be titled The Case Against Schooling. I mean, he is the master at believing in education. But he said it will sell more copies if it's called The Case Against Education. He's probably right. But anyway, his extreme estimate is that 20% of schooling is human capital and 80% is signaling. I kind of went, how about if it's 40%? Because he is on the extreme. And that's how we came up with the 1 trillion.
And there, as David said, there are other costs that come into play as well. So that's one reason why we think these are actually conservative numbers. We could have actually bumped them up for if we would have went through some additional sensitivity analysis.
Oh, and before you go on to the slide, notice the number, back to that slide, right? Notice the number of lives you'd have to save. Just from this one component, this one sector of the economy. No one believes we're going to save anything close to 200,000 lives.
Let alone 500,000.
Right.
So let's look at the other costs here as well. So that was a human capital development cost, and there are things that economists have a hard time placing values on. Okay, so and one of the big ones out there is this idea of isolating children, not letting them interact with their friends except over Zoom and that kind of thing. And so there have been a number of studies that have come out now since these shutdowns have occurred in showing that these shutdowns have been having devastating psychological consequences for children as well. That survey after survey has just shown the impact on depression. And it's just, and here's the thing too, is we don't even know the long-term ramifications of a lot of this stuff. You know, this is just what we know right now. Okay. The other thing that would play into lost GDP figures, which we didn't even calculate, but there are a lot of Americans out there that have childcare issues right now. And, you know, a lot of those issues are, as we state in the op-ed, they're most critical for, you know, single parent, the low income and minority households. It's the people that can at least, you know, they can't afford to have a nanny. They can't afford to hire a private tutor. They can't afford private school. And so what ends up happening, they end up doing a lot of it, you know, themselves. Okay, and it impacts their incomes, and that's more GDP losses that you would have. Okay, and like I said, we didn't even get into those numbers, but those are huge numbers. Okay. You also get issues. You know, my wife is a contractor. I'm luckily a professor during this whole thing, but you know, my wife has cut back on her work hours to help take care of the kids, and so it's not just that, you know, people are leaving the workforce and that kind. It's also you're cutting back on hours as well. Now, there's all these substitution effects and all these other impacts. But here's another big thing. You know, who is this impacting? Who are the people that are leaving the workforce to take care of their kids? There's some pretty strong evidence that it's females. Okay, so when David and I originally wrote this, the month before our article came out in September, and this is just in the month of September. Just in the month of September, they were seeing 865,000 fewer women in the labor force that just left. They just left. And you compare that with the men, you're looking at 216,000. Now David and I don't know exactly how many are in that total because they were dropping out because of health or childcare issues. But I got to say, it's got to be an awful lot of them. I don't know exactly how many, but it's just a striking difference in the numbers. And I think that's
one seat of the pants way of seeing it is look at the number for men and assume that in a normal month it'd be roughly the same number for women, because men and women are roughly equally represented in the labor force now. In fact, we should have done that. It'd be very easy to do that, but I probably will today. But take that as the baseline for women, which means an extra 600,000 and some women leaving because of this.
The numbers are just, they're so striking, David. Anyways, there's, I do want to open this up for questions, but that was kind of the basis of our argument. And I think it's pretty clear the benefits for opening the schools far outweigh the costs. My personal opinion is that the schools should be one of the last things that we shut down in society. You know, if you're looking at like New York City, you know, they're shutting down the schools. You got people, you know, people still go to bars, all that stuff, but then they're shutting down the school. Like it should be one of the last things that we shut down. Like, I mean, so personal opinion, but that's kind of where we are. That's what the literature says in terms of this.
Right. Well, it's a personal opinion, but it's a personal opinion that follows from our analysis. So it's
correct.
I think you can get rid of the slides now, right?
Yes.
Yeah. I just want to add one thing before we go to Q&A. One of the benefits we didn't even quantify of having the schools open is you get closer more quickly to herd immunity. Now, lots of people have been critical of herd immunity as if it's a strategy. It's not a strategy, just as gravity is not a strategy. It's just something that happens. And by the way, if you look at vaccines, what have they always been about? Getting herd immunity. So however we get there, it's important to have herd immunity. And so we would have gotten there more quickly if we hadn't closed the schools in the spring, if we hadn't shut down all kinds of summer camps in the summer, we would have been much closer to herd immunity.
Any questions? Open it up. Anybody? Going once?
Well, I have a question. So how do you get the elected politicians to get away from what they're doing now and try to look at it from a scientific standpoint?
You got to find ones who have some courage and some numeracy, some willingness to look at numbers. So I can't tell you who I talked to who did this, but he briefed the governor of Florida back in July for 2 hours on this. And the governor had read widely in this. He showed, I hadn't known the governor of Florida was a Rhodes Scholar. And the next day after this briefing, he opened up Florida. And so, you know, you can do it. You can rely on the science. And it's important not to let people shout you down by saying, oh, you don't rely on the science. No, we do rely on the science.
I have a question.
Sure, I have to.
I noticed on your chart there, you said there were 81 deaths of under 15 years of age, but 434 deaths from flu, but that had 18 years of age. And I'm wondering the susceptibility of catching the COVID as the age gets between that, say 16, 17, and 18-year age group.
Well, I don't know exactly. I think it goes up within that age group roughly linearly. So it wouldn't be a huge difference, you know. So if you extrapolated, see what they have is they have estimates between 15 and 24. So actually a way that would overstate the number of deaths up to 18 would be to interpolate and take that fraction. And you're going to overstate because it does go up within the age category. I could do that. Just eyeballing it, just thinking about it, I bet you'd show that we have about 110, 120 deaths in the same age range with which we're comparing the flu. But good question, and I'm going to do that one too.
Okay, thank you.
Any other questions?
I have a comment.
Yeah.
And I guess the comment is you make it. I think the case you're making is quite strong, but the problem is that the people who have to make the decision to get kids back into school are wildly diversified, and we're, I think, suffering from from the fact that it's largely local control, and people are without. It's very easy to make one decision. When that decision kind of then goes all over the country, to try to reverse it, it's very difficult, because nobody wants to be the person who is responsible for taking someone's life, even if it was a small probability. So it just seems to me that this is going to be very hard to turn around until we have a vaccine or something. I mean, I get the calculations. I think it's very compelling, but do you really think that we're going to do anything?
Well, if we look at certain states, they certainly have. It's not the case that students are closed and schools are closed in every state in the union. And they're sometimes open. We're in areas where they have more cases as a percent of the population than we do, at least on the peninsula, where we've been very, very clear. So I think, yeah. And again, that gets back to courage and numeracy. So, I mean, even think of New York, think of de Blasio, not my favorite politician, but until a couple of days ago, he had the schools open in New York. So, you know, I do think it's quite plausible. And I think what's happened is we've gotten into this kind of status quo bias where we're so used now to things being closed that it's hard to imagine them being open. And Jack, I'm not saying it's hard for you to imagine, but it's hard for many people to imagine. And so my view always is I'm trying to move the needle. I'm trying to get people more informed. Will that do it? I don't know. Will it raise the probability of a good decision? I think it will.
Jack, I'll add on to that with what David said. I think what you bring up is pretty spot on. I think it's going to be quite difficult. You know, we're academics and we're running the numbers here. One of the central problems with something like this is the idea of a COVID death taking place. It gets on the news. In fact, a COVID death in the age groups that we're talking about is probably on the national news, to be quite honest. That, if you take that in a comparison to lost statistical lives, those things aren't on the news. Okay, so I have a 5-year-old daughter. By the way, I have a kindergartner, a first grader. So as I've told David, this particular issue is very important to me. It's very personal. Now my daughter, we might have to hold her back. Okay, that means she's going to have a full year later that she has to wait on in terms of her human capital development. She's going to graduate. Well, we'll see. We'll see where we're at next summer, but it's possible she could graduate a year later now. That's a year back from the income that she can get. And we know what happens in the data when you lose income. And so we're talking about deaths 10, 20, 30 years down the line that we're not seeing right now. And those are statistical lies we're talking about. And so it's very hard to combat this idea of COVID deaths versus statistical lies because you don't see them until later on and when this plays out. But your point about that, I think it's going to be really hard to change minds on this, just with the way this is playing out, unfortunately.
By the way, I just want to add on that Ryan is not just an economist, he's a parent. And so when we have these discussions, because we've been talking about this a lot for the last 2 months, what I hear him saying typically is not, my daughter's income is going to be 10 grand a year lower. It's, my daughter doesn't get to do her Christmas pageant. My daughter is missing these interactions with other kids. That's why I said I rewrote the piece to get it more Wall Street Journal style. That's why I added the line in the piece, and on the playground. You know, I don't want them just in classes. I want them on the playground. And I just think that's very important.
Yeah, and it's not, you know, we ran all the numbers, David, and the numbers clearly say that we should be opening schools. There are these things we just don't monetize. And you brought up a good one. You know, my son, you know, he was in kindergarten last year. You know, he had that play that David talked. We're never going to get that back. Yeah. That's one of those moments you're never going to get back.
Yeah.
How the hell are we supposed to monetize something like that?
But
you know,
and way to talk. But getting back to and this really gets back to Jack's question. It is a way to talk about this. If you're trying to get people energized, you might show the numbers on how low the death rate is. I mean, it's just so incredibly low. You might downplay the numbers on lost earnings in 20, 30, 40 years in the future. But what everyone can identify with is the lost the lost interaction with other kids, how important that is. And I think, you know, you could get some parents energized. And I think a lot of parents have been cowed by people like Fauci and so on, talking about the science as if the science leads to this conclusion.
Yeah, I'd also, sorry, I don't mean to monopolize the time. I have another really important point I want to put out there too. So I'm just one example of this, but there are many families out there like mine where we have 2 working adults in the family. Our kids, you know, they shut down the schools. Well, what do we do with the kids? We send them off to the YMCA. So all you're doing is you're taking the risk off of the teachers. You're just placing it on the YMCA staff. So I don't know. A lot of these decisions, I think that's what's going on in a lot of these studies too, is that they shut down the school and they're just not finding much variation, you know, across geography for the places that shut them down, because families find a way around this. They need childcare, you know, and so I just think, you know, when you're looking at those numbers, just specific, it's not just the schools. It's like, well, there's these kind of roundabout interactions that people have. And I'm hearing this about the hybrid situation too. So, you know, they're talking about going hybrid. Well, you know, I live out in Carmel Valley. So my kids are going to go 2 days a week to school at Carmel, you know, at Tularcitos. And then what are we going to send them to? We're going to send them to, you know, the other 3 days we'll send them to the YMCA. They're actually interacting with more people. So, you know, this situation, it's a lot more complicated than what people are thinking about. And we need to think through this stuff.
Yeah.
Good. Any other questions, anybody?
You know, the other thing that I've heard from a couple of very good sources, if I should be in an automobile accident and I end up in the emergency room, of course, they test me for COVID, and I pass away due to my injuries after a couple of days, the hospitals turn it in as a COVID death to get the federal money.
Yeah, there is that incentive. And I don't know how widespread it is. I can give you a counterexample. One of my other co-authors lost his mother 2 weeks ago. She was 92 in a nursing home in Santa Cruz area. And they did an autopsy, and sure enough, she had COVID, but it was clear she didn't die of COVID. And it wasn't listed as a COVID death, which made me feel better about it. But I absolutely have read data exactly like yours, Hampton, that say, yes, there is this incentive. And if you had to tell a non-economist what's the most important thing in economics, I think it would, well, there are 2 things. There's scarcity, there are no free lunches, and people respond to incentives.
Yeah.
Well, good. Anybody else? Any other questions before we close shop? And I would want to thank Ryan and David for the talk. It's very timely. You know, it's nice to hear that. I've also recorded this so that I will send links out to I'll have Don send links out to everybody if you want to rewatch or send the link to family, friends, so that they can.
Will we get the link?
Yeah, no, I'll send you the link as well.
Right. No. And also, I just want to say, I've given 2 talks in the past at Capital Club when you actually could get together, and loved doing it. I love I told Ryan, you'll virtually never get a gotcha question. You just get people wondering and being curious and adding their own input. And certainly that's been true here. And I also just want to do a shout out, because I'm sure a lot of you are friends with him, to one of my favorite doctors in the world, Ben Richards. I think you could argue he saved my wife's life 34 years ago. And anyway, so I just want to do a shout out to him.
Okay, great. Thanks, everybody. And if we don't see you around the club in the next couple of weeks, have a happy Thanksgiving, and we will, and you guys have a happy Thanksgiving as well. And thank you all for joining in. So see you later.
Thank you.
Bye.
Thank you.
Thank
Bye.
Thank you.
Bye. Thank you.
Thank you.